All right, appreciate that. CO Chairman Elsie, Ranking Member Pingree, and members of the subcommittee, thank you for the opportunity to speak today. My name is Jeff Wacoche, and I am Chief of the United Keetoowah Band of Cherokee Indians in Oklahoma. The UKB is a federally recognized tribe headquartered on our Cherokee Reservation in northeastern Oklahoma. We have been federally recognized since 1946 and have struggled to receive the rights and benefits to which we are entitled as a legal successor in interest to the extinct historic Cherokee Nation and the treaties our ancestors entered on behalf of the entire Cherokee people. We are entitled to provide health care services directly to our people under ISDA. In the early 2000s, the Cherokee Nation of Oklahoma assumed key IHS programs related to the Tahlequah Service Unit, including purchase referred care and control of Hastings Indian Hospital, without our consent. This was a direct violation of federal law, which requires that when one tribe seeks to assume a program for a shared geographic area, all other tribes in that area must consent. IHS unlawfully awarded a 638 contract to CNO for clinical services and PRC, despite knowing that we have never given consent. As a result, our members have been underserved and denied health care services, despite being entitled to receive care. As I said last year, this was not a technical oversight. It was a breach of trust. After reviewing this history, IHS confirmed that we are entitled by law to operate our own tribal health system and proposed securing it under the new tribes funding budget line in its FY 24, 25, and 26 budget request. IHS's responsibility is clear. It must provide health care to all federally recognized tribes, regardless of how long they have been recognized. The new tribes funding budget exists for this exact reason. IHS now seeks to correct its error. This error resulted in an ISDA contract which transferred $5.6 million in non-recurring funding to the UKB for 2024. Because PRC was the only program transferred in the 2024 contract, the entire 5.6 was allocated to PRC. In 2025, again, UKB received $5.6 million in non-recurring funding, this time receiving $4.6 million for PRC and $1 million for hospitals and clinics. We await award for 2026 of $5.6 million in non-recurring funding, which will be allocated across the programs negotiated for in 2026. While another tribal official has falsely alleged that our PRC funding is disproportionate to what other tribes receive, the full story is that we are entitled to $5.6 million annually for health care. Once we begin operating the additional programs, the $5.6 million will be allocated across those programs, just as it was in 2025. Recurring funding is necessary to allow the UKB to build upon our current successes and make substantial investments in furtherance of our healthcare system. Our request for recurring funding has been met with bipartisan support in both chambers. Unfortunately, we have not been included in the FY 24, 25, or 26 enacted budgets. We have already proven our ability to operate high-quality health programs under ISDA, successfully managing behavioral health and substance abuse services throughout our reservation with an annual IHS funding amount of $99,000. Our track record of efficient operations and prudent management is self-evident by our ability to transform that meager funding into a behavioral health system which now operates across 7 locations and provides services to more than 1,800 patients while employing a workforce of nearly 100 in rural northeast Oklahoma. We look forward to replicating this success throughout our tribal health system. Yesterday, you heard from one tribal leader who urged you to inflict harm upon a sister tribal government. How a tribal official who professes to be a sovereignty warrior could openly oppose critical health and education funding to another federally recognized tribe is beyond me and disrespects all tribes. His words have nothing to do with fiscal responsibility. Providing health care funding for the UKB will have no impact on funding to any other tribe, especially CNO, and will only increase access to care on the Oklahoma Cherokee Reservation. On behalf of the United Keetoowah Band, I urge you to correct this moral and legal error and enact the IHS's request to fund the UKB on a recurring basis. What else?
Thank you, Chief. Chairman Keys.